You can see my screen.
Yes, I can see your screen. Maybe you can blow it up.
Yeah, let me put it on presentation mode. Yes.
Okay, perfect. The screen is okay now. Thank you. Thank you so much, Winnie, for having me. And also thank you so much, everyone, for joining today's session. So my name is Mariam Yusuf. I am a mental health practitioner, and I have been in the field for, I think, 6 years now, since 2018, 2019. I do mental health training. I also advocate for mental health, and I practice as a counselor. So we are going to be doing a series of webinars for maternal mental health. But today we're just going to, this is like the introductory sessions where we're going to lay a foundation for us to understand what maternal mental health is. So even in the coming webinar series, when we go deeper to discuss, things like anxiety and depression, we'll be able to at least have a foundation of what maternal mental health is, and also like how that looks like. So I know that we are coming from different, I think different places. Maybe some of you are mothers here, or maybe some of you wanted to be mothers, or some of you have supported, mothers, like if we have caregivers in the room. And some of us have experienced pregnancy loss, we have birth traumas. So just a lot of people inside the room. And I know even as we go, hopefully not, but there's a chance that the session can be um, triggering for some of the people. So I think what I would advise you to do is, if you feel like you need to step away maybe from the session for a minute or two, you're welcome to do so. So you can just step in and then come back, even as we begin the session. So so Winnie, you can go to the next slide. Yeah, so today we're just going to talk about this. These are going to be the learning outcomes. So by the end of the session today, which is running for I think 90 minutes, you should be able to explain what maternal mental health is, just across the whole pregnancy period all the way to postpartum period, and be able to describe also like why it matters, not only just for mothers, but also like the babies, the families, and also like communities at large. And then one of the most important concept today is just the idea of the continuum, which I'm going to introduce today, because many people think, when we talk about mental health, many people think it's like two sides of the coin, but it doesn't work at a binary like that. So it's not like you're either you're okay, or either you're mentally ill. It works as a continuum, and we're going to look at how that looks like. So so I think that's what we're going to do, and then also like explaining how mothers move along that continuum, because a mother can be coping very well, like maybe like in this week they're okay, and then they're struggling in the next week, or maybe like they've been okay throughout the pregnancy period and during the pregnancy period, but then like they have maybe like a difficult birth or any other things coming in. So that's what we're going to, this is what is going to be like the key concepts of today, and just looking at how do we come in and what role do we play as a community. Next slide. So and also this is maybe something that I would want us to keep in mind, even as we go through this session, that that maternal mental health, it affects, it's not just about the emotions. It goes beyond the emotions. It's the ones that have they influence whether like the pregnancy outcome is going to be at the end of the 9 months, also like the birth experiences also, and then also like the parenting, how a mother is able to become a parent. So it goes beyond the emotions, because if your emotions are not okay, it can also affect how much of a parent, like what type of a parent you are at that particular time. And then yeah, so a lot of things, even an infant being able to develop fully the way it's supposed to be, or even like how well the family um is going, like the well-being of the family at that particular time, it's all going it all comes as a result of like what's happening to the mother. So it goes beyond emotions. And then the second thing is maternal mental health. Also, the way I've just said, it exists in a continuum. So there's no, like the way I said, like two sides of the coin. And then the third thing I'd want for us to keep in mind is like all mothers deserve emotional support. So most of the time we feel like only the mothers that have been let's say diagnosed by, like maybe like depression, or maybe like they're at a risk of something, we think these are the people that the only people that deserves to be taken care of, maybe like go through screening or check-ins. But also like a mother that looks like they're okay, or a mother that is not like clinically diagnosed with something, still deserve emotional support. And we are going to understand why this is important as we continue. And then the last thing is how it's important for us to be able to also just like recognize these things very early. There's a very big difference between, let's say, for example, if something was caught very early during the whole period of maternal, and when maybe like things are caught very late. Because if there are concerns that have been caught very early and they've been identified and maybe like addressed very early, they will have like better outcomes of like for both the mother and your child at the end of the postpartum period. So this is just the 4 things that we're going to look at, and with that I welcome you to the session today. But even before we start on the heavy things, I'd just like for
Mariam,
us to,
I don't know
yeah.
if it's me, but there's just a way you are disappear. You are kind of going as you are not audible enough. Maybe you can maintain.
All right. Is that better?
That one is okay.
Okay. Thank you. Yeah. So so even before we go like to the heavy stuff, I just like for us to sort of try and think about like when we hear the word motherhood, and like what are the words that come into our head, even the feelings, what feelings just come into our hearts, or maybe when we hear the word mothers. Maybe we can use the chat box for that, and then Winnie, you can help me just read what is popping up.
Okay.
Yeah, so like what words come in your mind when you think about motherhood? Not just words, but even emotions, like what emotions come to your hearts? Feel free to use the chat box for this.
Okay.
Yeah,
Yama
says
said,
age responsibility.
yeah. Any other person? Lorena said love and nurturing.
Love. Mm-hmm.
Any other person? There's no right and wrong answers. We are here to all of us to learn. Your voice is not very audible. Yeah, Mariam.
Yeah, okay. So I think we can
Yeah.
work with those two examples. Yeah,
Oh,
but
there's
I
another
think
one.
oh,
There's
uh-huh.
another one, responsibilities, and then there's also
Mm-hmm.
unconditional love. And then you can work on your mic.
Mm-hmm. Okay.
Yeah, so we can work with those
Yeah,
ones.
I think
Thank
what I
you,
love
guys.
about yeah, thank you, Vinny. What I love about what I'm just hearing from people is there's no one way of describing motherhood. Like people are talking about love, and then we have others that are talking about like responsibilities and like it's like we both experience like positive when we think about motherhood. There's like a lot of positive things that are coming with it, but then at the same time there's also like another flip side of the coin. So maybe like one mother is feeling like there's joy or love, or the way some people say it's a blessing. I've just got like my bundle of is it bundle of blessing or bundle of joy? Yeah. And for some people it even gives them like a purpose, like now I have a reason to live. There's a lot of positive emotions that are associated with that. And then also there's the flip side. Yeah. So there's people who fear that they become now mothers. For some people, it's like a lonely journey for them. Some people, like the way Yam said, responsibility. So others may be feeling a lot of pressure coming with that. Yeah. So there's like, I think what we are getting from the response is like there is like two opposite experiences that are coexisting in the same journey of motherhood. And I think this is even like a very good basis for us to be able to discuss why maternal mental health exists in a continuum, and like and all these two different experiences can exist in the same journey. So we can go to the thank you so much guys for that. I think they deserve to clap for themselves. This is the time they can pick an emoji really and just do things there on the screen. Thank you so much. Yeah.
Yeah, thank you, Maria. Yeah, you can use the to express how you're feeling and all that.
Right. Yeah. Thank you. So I think with this we can see that there's a very big misconception that, and I think even I used to be one of these people who thought when we hear about maybe like maternal mental health, we feel like these are things that it just starts when the baby is born, because I think when the baby is born it becomes a lot of people will now talk about it. I think that's where interventions will come in, maybe like clinical diagnosis or something like that. But then it's a very big misconception, because this whole journey, like the maternal health begins very early during pregnancy. In fact, the day that you're there in the doctor's office and they tell you it's positive and you're not pregnant, that's when it starts. It doesn't start later. So like things like maybe like anxiety or depression, even most of these things like start or rather begin during the pregnancy test session. They don't they don't wait until maybe like you already have your baby for them to start manifesting or for them to start showing. And in fact, even during these early stages, like things like anxiety and depression are like the biggest, I think the strongest predictors of like the postpartum mental health or any other difficulties during maybe during birth or maybe during postnatal. So when you look at now the birth, which is also like a stage, this one can be very psychologically traumatic for a lot of people. And I think a lot of women experience even just like frightening things during birth. It doesn't even matter whether you're doing it for the first time or not. But regardless of how many children you'll have, like each child will have their own experiences. We've have children that will take you to emergency procedures which you had not seen. Or I remember growing up, I hope nobody here works at Madare, then suddenly our neck is being hunted. But like even growing up, I used to hear stories about, not Madare, but Kenyatta. So they tell you when you're like the nurses are very rude, such things. And for some mothers, you ask them like, when are you having your, like a second child? And they tell you, I don't want to go through the trauma that, I was like how I was treated badly. So even just being handled with a lot of maybe like disrespectful. Yeah, when the care is not disrespectful, can also be an experience that a lot of women would not want to go through during birth. And the danger is some of these experiences leave a very lasting emotional scars for women. It doesn't just end at that, but it's something that they carry from the time they leave the ward to until when their baby is, I don't know how months old, but that's the reality. So, and then also I think another misconception we have is like postpartum ends in about like 6 weeks. So after 6 weeks is when you're told, oh, you can do this, you can, start doing this again or something like that. And then also like even clinically, postpartum period extends um, beyond the 6 months. So even the systems that we have right now for healthcare, they'll only monitor mothers until like, that age. After that, you're on your own. Nobody will still like check in with a mother or maybe like try and monitor them past maybe like when the baby is like 4 months or 5 months. But the truth is it goes from all the way from pregnancy until like 12 months. That's when you'd be able to say, okay, yeah, maybe there's no need for like like frequent monitoring the mother and um just checking in with them. Next slide. Yeah, so this is, I think, the continuum, and I think this is just one of the most important frameworks when we are looking at maternal mental health at large. So we have, like you can see on the other end, we have mental illness, and then on this other end, we have well-being. So most of us think it's either you have well-being or you on the other side of like mental illness, and that's not true, because it's like it starts like that. There's that, and then there's mild, and then there's severe challenges, and then when it's severe now, no, from mild then it becomes moderate, then mild, and then it becomes severe. So when it's severe now, you're on the other end of the spectrum, and most mothers will fall between these two, between emotional challenges and psychological distress. So before even they get to like being diagnosed early, because that um, it's not very common. Most mothers are usually like between these two middle boxes. So they may not like fully meet the criteria for diagnosis, but a lot of women are very overwhelmed when during this period they're isolated, they're exhausted, as the way Hiam said, it's a lot of responsibilities which 9 months before you didn't have. So now it's just there new with you. And then also struggling emotionally is just one of the things that women go through. So I think even in the current systems that we have, the healthcare systems, services are like designated only for mothers that have reached that far end of the continuum, and like these other, sides are not being checked. And I think that's one of the most important things we are trying to do, even as Nivishe, to be able to, like, how do we recognize this distress very early, and how do we support women even before problems can become severe. And now we are talking about like, like treating mental health disorders. Next slide. So it is broader than postpartum depression. I think this is also one of the things that I touched on early on. So because when we hear about maternal mental health, we just think about like postpartum depression immediately. But depression is just one part of the whole picture. There's a lot of other conditions or things that are involved in the in maternal mental health. So that includes things like anxiety disorders that are there. I think I've talked about like birth-related traumas, like things that happen during birth, like those emergencies or whatever happens during the labor in the delivery room. Sorry, and then also there's obsessive compulsive disorder, and we're look at
Hi,
also
Mariam.
how that looks like, especially after.
Mariam, we have lost
Hello,
you. Or is it me?
can you hear me now?
Uh, Speak again,
When you confirm if I'm back, am I back?
but you are a bit low. Kindly, you are a bit low. You can add maybe your.
Okay, let me see what happened. Let me see if I can try and switch
Okay,
it.
right now I can hear you.
You can hear me? Oh, okay. All right. So confirm
Yeah,
at what point did you lose me? At what point did you lose me?
but you are talking about the OCD bit.
Oh, yes, yes.
You have
So is
you have
we're
broken
going.
again. Um,
Okay. Yeah. Confirm you can hear me now. I'm so sorry about that. I don't know. I'm not sure what's happening. Am I back?
Now that one.
Okay.
Yes, yes.
I was saying we're going to look at like the OCD and how that it's like. Yeah, but that is also just a condition that comes up. It's not just depression alone. There's bipolar. There is also postpartum psychosis. That's also like one of the things that come up during the entire journey. And then also finally like how difficult or easy it is for a mother to be able to adjust to now having like being a new mom. And this one just deserves its own like particular attention, because it's not it may cause like mental health challenges, but you can't like put it under a diagnosis. So because like it's just, I think it's normal, because many mothers will experience that distress, and maybe like their daily lives will be affected as a result of it, because this is something that has just come new, but it doesn't meet the criteria of like a psychiatric diagnosis or something like that. But however, it's still important, an important like part that shows up during the journey, and mothers needs to be supported also during that period. Thank you. So we have, I think these three things usually gets confused, because I think even for me at the beginning, I couldn't tell like how do you differentiate between whether like a mom is just having like those baby blues, or whether they're in like maybe like experiencing postpartum depression. How do you know it has become very severe, and just a lot of things. So maybe I think in this introductory session, it's important for us to be able to distinguish or maybe like differentiate all this. And these are different conditions. They're not the same thing. Um, and also how you can tell is how quickly a mother is able to snap and what level of support they need. So for example, things like baby blues, it's something that is usually resolved within 2 weeks. And at this time, even the mother might not need like an external intervention or maybe like sessions or counseling for them to be able to recover. It just comes, and the way it came automatically, it's very possible for a mother to get over it. Um, on their own without even like seeking any external help. But then for postpartum depression, this one lasts it lasts longer. It lasts longer. And then how you know is the baby blues might not necessarily affect a mother. So they may have it, but their life will still go on in a moderate and maybe like a decent way, the way it's supposed to go. But for postpartum depression, a lot of daily functioning is affected for this mother. So maybe they may not be able to take care of themselves, things like taking a shower, or like being lively, being there. Maybe they may isolate, stay in their room maybe like the entire day. They don't care whether the baby has eaten or not, such things. But also don't worry, because like in the series of webinars we're going to have, we're going to like go deeper in explaining like how would you identify a mother has, for example, is under anxiety or depression. We're going to look at that. So postpartum depression, that's how it's work. And with this one, it requires like an external support or treatment. So meaning like if a mother is experiencing this, they may not be able to like help themselves out, for lack of a better word. They can't snap out of it, or it can't just end, automatically, because a certain period of time has ended. They would need someone to be able to help them. And then with postpartum psychosis, this one is rare, but it's like emergency level, and this one requires like an immediate and a specialist intervention. So with this one, it's not even about like bringing in maybe like someone like a counselor to talk to the mother, but rather how do we, even like medications may be involved at this particular time, because when it becomes to a psychiatric emergency, it's because it's psychosis, and then that puts the mother's life in danger as well as the child's life in danger, because this is the stage where you may hear stories about maybe mothers harming their kids, or so like that end point when it gets worse like that. So and this is something that can be monitored for like 2 weeks, and that is like, I think, the mark for it. Then it means that something needs to be done. So if anything goes beyond 2 weeks, then it can't fall under the baby blues. So that's the easiest way to do an assessment on it. So we can go on the next slide. All right. So here, this is now what I think this is very deep, because this is what tells you. I think just looking at like 70 to 100% women experiencing this makes it very. We feel like this is why we exist. This is why maternal mental health care is very important, because just looking at the numbers, they're very high. And I think this is maybe like the most important slide in today's session, because then it talks about the dangers and all that. And a lot of mothers, you can see 70 to 100 will experience intrusive thoughts. And intrusive thoughts are the thoughts that you don't want them. They just come unwanted, and they're very distressing and very frightening. So I think even me as a mother would go through this, because sometimes, I don't know, you can imagine like someone like me right now, used to sleeping in my own bed alone, and then so I wake up and then I have this baby. I might even think that I would suffocate them at night or something. Then I end up in the morning and they're dead. So anyways, that's just an example of an intrusive thought. And a lot of mothers experience a lot of this. So maybe they think maybe I can maybe accidentally drop my child and then they die, or even when I'm washing them, or a lot of things, they would feel like they would, in one way or another, maybe like accidentally hurt their baby. I think especially if someone is a first-time mom. And these thoughts will come with a lot of things emotionally, like guilt, or like what else, like maybe fear, or I don't know, something like that. So that means then at the end of the day, it affects like how calm and how sober, or how healthy mentally the mother would be at this particular time. So sometimes it doesn't mean that the mother would want to harm the baby. It's just like intrusive thoughts are just thoughts. You necessarily don't know where they're coming from, but they're very, very real. So so in OCD, I think with this one is when just talking about it further. So like so OCD basically just explain the whole pattern of thoughts being intrusive, and then when they're intrusive, they become then you obsess over them, like you become obsessed. That's why it's called obsessive compulsive disorder. So it's just there coming, and this can happen like in two ways. There can be thoughts that are like either ego dystonic, or it can be ego systonic. So with this one, with the first one, it means that these thoughts are not very consistent with what the mother is is feeling, or rather the values of the mother. So I may be someone that's maybe like, I'm caring, I want the best for my child, I want my child to survive, I love my child, but then the thoughts that are coming are, you're going to harm your child might die and you would be the cause of it, or something like that. And this can be very depressing for a mother, because there's no alignment. You're aware that this is not me, but then this might happen. I might cause maybe like this level of damage to my child. So it becomes very distressing for a mother. So with psychosis, with here, the intrusive thoughts are different here. Yeah. Because at this point with psychosis, like a mother is already, they're not in control of their thoughts. They're not able to tell whether their thoughts are, so they'll have like cognitive distortion. So with this one, the best way I can explain it is, I don't know how many of you have had this example when we do this, like, or rather we've experienced this when we were doing those communication trainings, and maybe like the trainer would put like a line of people, like 10 people, and then they would whisper on one ear of another person something, and then they tell the other, and then this other one will tell the other person the same thing, and then like that. By the time it's going to the last person on the line, usually like the word is totally different. I don't know how many of you have experienced that. So then like whatever is happening, so it means like the message has been distorted, yeah? So by the time it's happening, it's going to the end, to the other far end, like it's totally different. It's not even making sense, the message, or maybe like even the message does not even have a meaning. It's just like very funny. So the same thing happens in our mind when someone is not okay. By the time they are moving from maybe like a mild,
Someone has said it's called broken. Let me read
yes,
it
it's
for you.
broken. That's also a good way of trying to describe
Broken
it.
telephone.
Broken, yes, that's the name.
Yeah.
Thank you. Broken telephone, yeah. So so exactly the same thing happens also cognitively. So by the time someone is having that like cognitive distortion, it means whatever they're thinking in their head at that time is not even making sense at all. Just the same way the message doesn't make sense when it's distorted. And the thinking is irrational. This is the time where like something can be totally off, but someone is thinking about it. Explains why people would die by suicide, because of whatever they were thinking just before they attempted it. It all goes back to like, what are you thinking? In OCD, it can look like being very delusional. So at this point, already the mother is already like holding like very false belief, or rather they're very delusional. So whatever is in their mind at that time, remember, this other one would feel guilty if something happened, but this other one would not even recognize something like that is going to happen. They wouldn't even feel like it's against their value. In fact, if they would think about harming the child literally and feel like there's nothing wrong with it, and it's because they're not mentally okay, not because they're like evil people, or maybe I remember like in 2020 in Mukuru, we were just invited. There's a very good friend of Nivishe who does a lot of community work, but from an Islamic perspective. So she supports women who are in Mukuru kwa Jenga. There's that slum. I don't know if is it like close to South C or South B? I can't. I don't know if I remember. But there's a very big slum there around that area that and she supports women there. And how she supports them is just like in terms of like food, just other humanitarian work, not mental health. But then there was a time she had a very big crisis about mothers. And we were invited to go and talk to those mothers and see what was happening. And I think at that time, like the things that you experience at the first time, and you're like, it's very easy for someone, a general person, to be able to judge such a mother and say, like, why would you even think about, harming your child? And sometimes it's things like, getting triggered by small things, like the roof on their head, maybe like when it's raining, it's like rain is coming inside the house, or they don't even like the environment of their house, because most of those houses are like single mabati houses, and like the environment is not even, you feel already like you have your own thing going on. So it's it can be very shocking for an outsider to hear such things of a mother, and at some point they're not even aware they have these thoughts. They just feel like I want to even like kill my child, and then probably all these problems will go away. So it's very important for one to be able to differentiate, like when the intrusive thoughts or rather ESOD is ego dystonic or is on the other side, because when you know the difference, you'll be able to access even more, and maybe you're not like getting shocked, because now when you're shocked when you hear them talking, you'd want to ask like, what do you feel about that? Someone that's on the other side will tell you, oh, I'm very scared. I don't know what I would do to myself if I end up maybe like one day I wake up and I've hurt my child. So you know, okay, this one is dystonic. But someone who is maybe like sharing this and they're not aware, they would know that this person is and now this one has become like psychosis, and it means like it's an emergency. Yeah, so help cannot be delayed with this other one, because now there's danger, like the child's life is in danger. So that's I think what is standing out on this slide, and something very important for us to note. And even looking at the statistics, like 70 out of 100, that's a very huge number. So we can go to the next slide. We need, all right, last slide.
I skipped this one.
This is the next one. No,
Yeah.
it's here, sorry. Yeah.
Okay.
So yeah, so with this one, also this one is just showing like what statistics are looking like out here. And I think, yeah, so this one shows like, I think maternal mental health is at this point a very it's a major public health issue. It's not even like yeah, I think that is what is coming out, because if you look at like low income countries or even middle income countries, 1 out of 5 mothers will experience a very common perinatal mental health condition, one of the conditions that we talked about in the previous slides. And then these things, the changes and all that, they don't occur in isolation. It's because they're I can say they are very strongly influenced by things like poverty, like that example that I've just given about the Mukulukajenka site that we went to visit. And then things like gender-based violence, adolescent pregnancies, unwanted pregnancies, if someone didn't want the pregnancy, there's just a lot of things. And then also one of the major causes also is limited access to healthcare for mothers, and also lack of social support. So these are like the issues are they're very structural, and they're not very personal things. So it means like yeah, so I think one of the interventions, or rather like one of the strongest protective measures identified even through research, is just social support. Social support is just one of the things, and being able to identify it early, as I mentioned, so that they may not end up like on the other side of the continuum, and just social support. I think that's the most important thing. We can go to the next slide. All right, yeah. So yeah, this is why mothers are mothers. And this is because you can see, like, even in the diagram, like the mother is just at the center, and then there's this whole world, like nothing literally stops at her. Like maternal health, for a mother, like the health, it affects more than just the mother herself. It goes beyond, it goes beyond her, like it from the mother all the way to, like, it can affect the bonding that the mother will have with the child. At the end of the day, it will affect her parenting as well. So if the mother is not okay, they even her being like the ideal parent at that particular time, that's affected. And then also like the baby, like the emotional development is also something that can be affected if the mother is not okay. The family relationships, the community, it's like the mother is like the source of that. But even with this one, I think we'd want to be careful not to like frame it in such a way that we are blaming the mothers. But I think the most important message is that it's not the mothers that are harming the children and the family. If we can just get that straight. If I gave that message, I take my words back. But I think the message here is like if the mother is supported, like mothers will deserve a lot of support, yeah, because their well-being will create like healthier families, healthier bond, and all that. So that's why it's very important for mothers to be taken care of, and at all the stages, all the way from pregnancy to the last. So yeah, so we can move to the next slide. Yeah, so I want us to do something here. It's a case study. So we're thinking maybe this mother is called Aisha or something, and she's like a first-time mother. And yeah, this is just for us to be able to see whether like for the first, I think, were they like 11 slides, whether we were able to pick up something that we would use. So maybe, for example, just imagine we had like a young mother, maybe first-time mother called Aisha, and after I think 3 weeks of postpartum, these are the things that are showing, like the report. Um, um, what is it called? They're feeling overwhelmed. They've not been sleeping very well. And then maybe you notice that they're frequently crying. They're crying, I think, most of the time. And then they even tell you they feel maybe guilty. So just looking at that and maybe looking at the things that we've talked about at the beginning of the session. So I just want us to be able to discuss. I think this is going to be a very, no, okay, I don't know whether we're doing breakout rooms or maybe we can use the chat box, but I just want us to discuss these 3 questions. So like what concern do you notice? And this one you can go beyond okay, I don't want you to think beyond clinical treatment or something like that. Maybe you can just consider looking at it like emotionally or socially, or in terms of like what support they would need, what are the things you would want to question, especially here feeling guilty. Because remember we talked about like the intrusive thoughts. So like the first question is like, what concerns do you notice? The other one is what support might help Aisha at this stage, and then the last one is um like at based off what you come with, like at what point do you think like the support should come, like would referral become necessary or not based off Aisha's story? What are practical support that could be offered by to Aisha? What do you think are further information you would need before you help out Aisha, or even the things that you would notice just on your own? So I think we can do that, and I want to believe we're almost done. Maybe Winnie, you can click on the next slide and we see whether we're almost done. I think that should be the second last slide, if I'm not wrong. What's on the next slide? Okay, yeah, I think that's all right, yeah. So we can do this exercise. Winnie, you can guide me on how you want us to do it, whether you want us to be a breakout room or maybe people can just put in their thoughts on the chat.
Yeah, we can just share and put in our thoughts here and also in the chat. And also if someone wants maybe to speak, I think that will be okay.
Yeah, I think it'd be good to hear people's voices, don't you think?
Yeah,
We can go
exactly.
with the last one. Okay.
Yeah. So maybe I can also call in their names. I can see Monica.
Yeah.
Yeah, Monica, anything you have to share? Kaonga, Steve, Siziwe, Sia. Can say several. Anyone who wants to go on and share? Rosemary, Akram. Or you can even type it in the chat box and then I'll read. So there's one comment in the chat box. Let me read it. Okay. Kaonga said, thank you so much. It was so insightful. What about the question that you have posed here? What do you think the discussion about Aisha? Yes, so Monica has said she's emotionally burdened and she needs someone to show care. Any other opinion?
Hi, Winnie, is it okay if I go?
Yes, please, you can go ahead and share.
Yeah. After noticing all this, like that she's feeling overwhelmed, so you'd be concerned for her in that you're wondering, is it just the baby blues? Is it postpartum? Is it psychosis, like you guys were describing them? But then the support that might help would be if she needs chores done or if she needs help with either the baby herself or the house, or just somebody to listen. And then if that support, like sometimes when you eat, shower, and sleep, you are a totally different person than you were before when those things were missing. So if those help, then it was just the lack of the support, and there's no need for help to be sought. But if it persists or it's worsening while the support is there, then maybe you can look for help then. That's my opinion. Thank you.
Yeah, thank you so much. Yeah, even for me, maybe what I can also chime in and say is what I've also learned is like 3 weeks is already prolonged. What I learned is like the baby blues and all that happens within the 2 weeks window period. And after that, that might be a call for diagnosis and maybe further assessments. And clearly, when you look at this, Aisha is having on the unpleasant side. There's feeling overwhelmed, sleeping poorly, frequent crying, feeling guilty. So all this is too much for one person. And I think at this point, like she really needs like further diagnosis or assessment, maybe to determine if it's just like, what is it happening? Because this is like a red flag. That's what I can input.
Hey, thank you. Thank you so much for that. And I think I like how you both, I think, brought out the issue of timeline. So when you say you look at like if it's persisted, it means like they would need further interventions. Those are very important things to look at. So I think even like what we're seeing on the screen is what Aisha is, probably experiencing them emotionally, things that are happening like internally. So I think the most important thing to look at, especially if we talk about the slide of differentiating, remember the slide that when we were talking about how do you differentiate between baby blues and when it has come to depression and all that, this is a very important thing to be able to check. So you want to check, has she been experiencing this for, if it's for 3 weeks or longer, or even not less than 2 weeks, it means they've gone beyond baby blues. And now it's like you want to check whether this person is actually, if Aisha is actually depressed or something. And then also like things like poor sleep. I know even for like when you're a mother, you like sleep is usually very that is expected when you have a newborn. So also like being able to jump into conclusion, say, oh, you're sleeping poorly, there's a problem. So you'll want to check. So okay, so if sleep is normal, let's look at this sleep. So maybe these are things you might want to check. So if do you experience a problem sleeping even when the baby is sleeping? So like when the baby is sleeping and you're not able to sleep yourself, so it has gone beyond the baby and now it's you. Why are you unable to not sleep? Is it the anxiety that is preventing you from, resting or even like sleeping? Like even when we hear things about like frequent crying here, for example, is it because you're not sleeping and then like you're, because when you sleep deprived, your emotional state is not at this point is not also okay. So these are the things that we might want to check with Aisha, because it could be either baby blues, depending on the time frame, and then, or it can be early signs of postpartum depression. So that can also be something that's coming up, or postpartum anxiety, or it could be like the fourth thing that we talked about in that slide, adjustment difficulties. It could be like she's just having a difficult time in adjusting with this new thing. So I think this is just like a very, and then on like what help does she need, depending on what is coming out with Aisha, you might know, is it like a clinical thing that needs to be given to like a clinician for further symptoms, um, especially that one for feeling guilty. So what is she feeling guilty about? What are some of the things that are going in her mind? You would want to check whether she's experiencing any intrusive thoughts and what she's feeling guilty about, and just see like how that is happening. And other key things, I think people who are in maternal health would tell you important things like nutrition, maybe like how well they're able to bond with the baby and things like that. So like a clinician or maybe like an expert would be able to check. So you even being able to do the screening would be able to help you identify what interventions Aisha would need at that particular point. So I think everything that we've discussed today in this introductory session it's just very key, and I hope it has given us an idea of why maternal mental health is important, or what else, like other important things like the continuum and how it works. What other thing have we talked about? And especially also like the OCD, the two different types of OCD when we talk about maternal mental health care. But also don't worry, because this webinar is running in a series. So like in each week, each session will be going deeper on a specific thing. So even today we've just touched on OCD, but it's just there's a lot of things also just to be tackled on OCD on its own, on anxiety on its own. So by the time we are done with the webinar series, you'll be able to have this awareness. That's why we are encouraging you in short to register for other sessions that are coming, so that you're able to get like a full idea of that. And with that said, I think we can just do this reflective because we've literally come to an end of the session now. So we can just, you can tell me like what surprised you today? Have you learned anything new? As much as this is just like an introduction. And then also you can tell us what support do you think mothers need the most in your own communities, where you come from? Like what support do you think mothers will need in your communities? Yeah, so I think we can do that, and then I'll hand it over to Winnie. Yeah, feel free to use the chat box for that. Maybe we can combine you can reflect as you also share with us like your final thoughts. Maybe when you can go to the last slide, then we can tackle both together. These are just some of the evidence and sources about our slides today, and so we can So feel free to share your final thought and also just put on some reflections on the chat for today's session, and then Winnie, back to you.
Yeah, so we can give a few minutes. Maybe anyone wants to share or maybe to text. Also, you can also do it as a reflective question. Yeah, I can see a hand. Monica, you can go ahead.
So thank you for this session. Let me answer the question. What surprised you today? Everything, because a short introduction about myself. I'm Monica Nyambura from Madare. I'm a co-founder of an organization dealing with teenage mothers, and this information is really helpful. So I got to learn that postpartum, someone dealing with postpartum past 6 weeks, that is something that needs urgent attention. I didn't know about that. And if you can say the kind of support mothers need in my community is love from the other people, and also they need to be included in all activities happening.
I don't know if you have completed, Monica, or you have broken away. Yes, so I can also read the chat, and Hiaba said I was surprised that maternal health starts at pregnancy, not birth. Yeah, and I think we are so many. I can see even Maham saying the same. And I think it also surprised me. I've never known that. And most of the time in our society, we tend to talk about the postpartum depression. I think most people have had maybe baby blues for the first time. And most people tend to judge or just assume the psychosis phase where you hear like someone gave birth and threw their child into the pit latrines and all that. We always tend to judge. But honestly, that surprised me. We didn't know like there are all those phases, and the timeline can be very, very varying, and the impact that it has, it can be very huge. You know, when someone just decides to harm a child, it doesn't come from a point of consciousness, but it means it has a lot. And the way Hiyama said, apparently it starts from pregnancy, you know, that is like, it's just news. And at least I've learned something great today. I can see another comment. Let me just read it. On the support needed, it's physical support, financial support, and emotional support. Yeah, also add the nutritional support. You've said also what you take in as a mother. Remember now you're eating for two because there's also breastfeeding. Yeah. Please feel free to share more inputs. You can write on the chat. You can speak if you wish. Yeah, and maybe we can breathe in for just a minute or two so that we can continue, because also time is not really on our side. Siziwe Mfula said, I joined in a bit late, but it's been quite insightful. Thank you so much. surprised me are the numbers and how prevalent these conditions are. And I think what mothers need is emotional support, empathy, and patience. Yeah, motherhood is an eventful journey that requires a lot of guidance. Yes, thank you. Thank you, Siziwe. And I wish you could have also typed which country do you come from, because that's a unique name. Yeah, thank you so much. That is very insightful. Mothers need a lot of, yeah, support, emotional support, especially empathy and patience. That's awesome. Any other person? Yeah, joining in from Zambia. Yeah, welcome so much. Anyone else who feels to share, to text? So in the meantime, we are going to have Hiam. I'm not going to ice break on her, on her journey, but she's a mom, she's a caregiver, and I'm going to give her some few minutes, and she's going to share with us her journey. Yeah, so part of this webinar series will be like just to listen to lived-in experiences. How has it shaped them? How has the journey been? Because I believe motherhood, the way Cecilia said, it's just an eventful journey. It's never linear. So here, welcome. You can share with us your lived experience in motherhood journey.
Thank you, Winnie. The motherhood journey is eventful, like you guys already said. And I think this is the part where Kenyans say, mambo ni mengi masatu ndo machache. Like, there's a lot to say, but the time might not be enough to cover everything. First, I wanted to say thank you. I have learned so much. I thought I knew so much, but I've learned so much. And I'm looking forward to this series and learning more in depth on each thing that was touched on and more. About my lived experience as a mother, it's just that I didn't know the maternal mental health starts at pregnancy. And I feel like there's a lot of information about how you should prepare for pregnancy or what you should do when you're pregnant. That's all physical, like what you should eat, your nutrition, like you should eat food too, like take supplements. But there's not much going on when it comes to the mental aspect. Like you don't hear much being said, but your body is changing, your mind is changing, the way you think is changing. And then maybe you're just focused on this birth event, labor and birth, and then you realize there's a whole world after that. I know there's a Kiswahili proverb that say like the work is not to give birth, it's to raise the child, because that is constant, never ending 365 days, 7 days a week, 24 hours. Sometimes you're doing morning shift, night shift, middle of the night shift, and then early morning again. And if you have multiples, that's a whole other ballgame as well, because you're caring for all of these people, and then you're supposed to care for yourself as well. But the minute you become a mom, your whole world changes. You know how you can just wake up whenever you want, go to the toilet whenever you want, eat whenever you want. All you have to do is check if you finished your work where you are, and then plan your lunch. Sorry, I have a little assistant with me. So once you become a mom, all that changes. Like immediately you become number two. Then you're on a cocktail of hormones as your body is balancing all of that out. Like the one in charge of breast milk, again, estrogen, I think, all of those cocktail of hormones, lack of sleep, it's a lot. Somebody was joking that the constant crying of the baby, the lack of sleep, and how hungry you are, but you never seem to have time to eat. Those are like torture techniques, but we're doing this willingly and we're looking forward to it and we're praying for it. And that's not to paint motherhood in any bad light. It is incredible. Maybe there's a way to articulate the hardships, but there's no way to articulate how wonderful it is. Like it's just something that the person has to experience for themselves. So just a lot of emotional support is needed. A lot of physical support is needed sometimes. you feel like maybe somebody needs to hold the baby while you eat. Like we said, there's all these intrusive thoughts. You're thinking, if I put the baby here to go shower or eat, something will happen to my baby and it will be my fault. So you're constantly vigilant, constantly battling intrusive thoughts, while also physically healing from giving birth, and while your hormones balance out, the pregnancy one, then the postpartum one, then the breastfeeding one. So it's just, well, a lot. But it's the best thing and it's the most challenging thing at the same time. Thank you, Winnie. I hope I didn't talk your ear off. I appreciate the opportunity.
Hiyam, thank you so much for sharing that with us. Yeah, it's really good to hear about the experiences that mothers go through and, just knowing how it can be on the ground. Myself, I'm a mother as well, so yeah, I relate a lot to a lot of the points that you shared. Winnie has stepped out a bit, but we can just maybe hold on a few minutes, but she should be able to join us. Yeah, thank you so much. I don't know if there's anyone who'd like to share again.
Yeah, well, Miriam, we can take in questions. I can see we have like 9 minutes remaining before the end of the session. People can just, if you want to, because I know there was a Q&A as according to Winnie's plan, so they can, if anyone has any questions, they can ask at this point.
Yeah. Thank you. So anyone? Yeah, you can still text in the chat. Yeah. So I hope everyone got, in the meantime, I hope everyone got to fill the link in the chat box kindly. Please ensure that you fill it before the meeting ends. Also, I'm going to share an attendance sheet. We will want to record at least the people that participated. And please note that your information is safe the way I said. And all the do no harm principles are going to be observed, especially the confidentiality bit and all that.